Now let's talk about something very important, which is the thyroid gland. So the thyroid gland is basically going to have a right lobe and a left lobe and a median isthmus, which is extremely narrow. So it is a vascular organ which is surrounded by sheath from the pretracheal layer of the deep fascia. So the sheath is going to attach the thyroid gland to the larynx and the trachea. Here I have a view of the sheath. So this is the capsule of the pretracheal fascia. So it is going to be surrounded by sheath, which is derived from the pretracheal layer of the deep fascia. Pyramidal lobe is often present, but not always present. It projects upwards from the isthmus towards the left side of the midline. Now let's talk about a fibrous or muscular band. This muscular band is also known as the LGT or levator glanduli thyroidi, and it is going to connect the pyramidal lobe to the hyoid bone. So you can remember this with LPH. The right and left lobes of the thyroid gland are pear-shaped and they have an apex which is directed as far as the lamina of the oblique line of the thyroid cartilage. There's also a base which is at the level of the fourth or fifth tracheal ring. When we talk about the isthmus is going to extend across the midline in front of the second, third, and fourth tracheal rings. Now let's talk about the relations of the thyroid gland lobes. So when you remember lobes, please remember lateral for the relations. So we have an anterolateral relation, a posterolateral relation, a medial relation, and a posterior relation. So for the anterolateral relation, please remember SOS. So S as in sternohyoid, O as in omohyoid, superior belly, S as in sternothyroid, and then we have the anterior border of the sternocleidomastoid as well. And then posterolaterally, we have the carotid sheath, where we have the common carotid artery, the internal jugular vein, and the 10th cranial nerve or the vagus nerve. And then medially, we're going to have PELT, which is the pharynx, esophagus, the larynx, and the trachea. As well, we have cricothyroid muscle, along with the recurrent and external laryngeal nerves. The recurrent laryngeal nerve is in the groove between the esophagus and the trachea. Now let's talk about the posterior relation. So what is going to be present posterior to the thyroid gland? Of course, the parathyroid gland. So we're going to have the superior and inferior parathyroid glands in the posterior relation. And we also have the superior and inferior thyroid arteries. Now let's talk about the relation of the median isthmus, which is very narrow.
So as we have done the lateral relations, the relations of the lobes, now we're going to head towards the isthmus relation. So I want you to remember that we have somehow passed the test. So please remember pass. So in a countdown of 2, 3, 4, we're going to pass this.
So for the posterior relation, we have 2, 3, 4 tracheal rings. And for the anterior relation, we are going to have the same anterior relations as we had in the lobes, which was the sternohyoid, the sternothyroid. But in addition, we have the anterior jugular vein as well. Now let's talk about the superior relation. So for the superior relation, we're just going to have the terminal branches of the superior thyroid artery. Talk about the blood supply of the thyroid gland. So we're going to have the superior, inferior thyroid arteries, of course, and we're also going to have thyroideima. The arteries will anastomose with each other over the surface of the gland. So superior thyroid artery is going to marry the external laryngeal nerve. So they're going to be partners. Then superior thyroid artery is going to descend downwards. And when it descends downwards, it is going to reach a mountain, which is basically the upper pole of each lobe of the thyroid gland. So when we talk about the inferior thyroid artery, I want you to remember IC, which is inferior thyroid artery is going to ascend to the level of the cricoid cartilage. And then it is going to turn medially to reach the posterior border of the gland. The recurrent laryngeal nerve is like a limbo, like it does not know where to go. So it is either in front of or behind the inferior thyroid artery or between the branches of the inferior thyroid artery. Now, if the thyroideima is present, then it is a branch of the brachiocephalic artery or arch of the aorta. So please remember that with TB. And I don't know if I told you before, but inferior thyroid artery is a branch of the thyrocervical trunk. Thyroideima is going to ascend in front of the trachea to the isthmus. So TTI. Thyroideima in front of the trachea towards the isthmus. So now let's talk about the veins. So we have a superior thyroid vein, middle thyroid vein, which are going to drain into the internal jugular vein. And we're going to have inferior thyroid vein as well. Inferior thyroid veins of the two sides are going to anastomose with one another, and they are going to ascend in front of the trachea and drain into the brachiocephalic vein in the thorax. Please remember DP for the lymphatic drainage. So laterally, this is going to be into the deep cervical lymph nodes, and some of the lymphatics are going to drain by descending towards the paratracheal lymph nodes. Now let's talk about the nerve supply, which is very easy. Just remember CSG for that, which is the cervical sympathetic ganglia. So we're going to have superior, middle, and inferior branches of the cervical sympathetic ganglia. Now let's talk about the thyroid gland functions. So thyroid hormones are going to secrete T3 and T4, which are going to increase the metabolic activity of most of the cells in the body. The parafollicular cells are going to produce a hormone, which is the thyrocalcitonin, which lowers the level of the blood calcium.